Top 25 Equine Veterinarian Interview Questions and Answers. Preparing for an equine veterinarian interview requires more than strong medical knowledge. Employers look for candidates who demonstrate excellent clinical skills, effective communication, sound decision-making, and a genuine passion for horse health and welfare. Whether you are a recent veterinary graduate or an experienced equine practitioner, practicing common interview questions can help you respond confidently and professionally. The following 25 equine veterinarian interview questions and detailed answers will help you understand what employers expect and prepare you to make a positive impression during your next veterinary interview. 1. Tell us about yourself and your experience as an equine veterinarian. I am a licensed veterinarian with a strong interest in equine medicine, surgery, and preventative healthcare. Throughout my education and professional experience, I have worked with horses of various breeds, ages, and disciplines. I enjoy diagnosing complex medical conditions, educating owners, and developing treatment plans that improve animal welfare. My goal is to provide compassionate, evidence-based veterinary care while building trust with clients and collaborating effectively with veterinary teams and support staff. 2. Why did you choose equine veterinary medicine? My passion for horses began at an early age, and I was fascinated by their athletic abilities and unique healthcare needs. Equine veterinary medicine allows me to combine my interest in animal science with problem-solving and hands-on clinical work. I enjoy helping horses recover from illness or injury while supporting owners in maintaining long-term health. This specialty offers continuous learning opportunities and meaningful relationships with both animals and their caretakers. 3. How do you perform a complete physical examination on a horse? I begin by observing the horse from a distance to evaluate behavior, posture, breathing, and movement. I then assess vital signs, including temperature, pulse, respiration, mucous membranes, and capillary refill time. I systematically examine the eyes, ears, mouth, heart, lungs, abdomen, limbs, and hooves. Finally, I evaluate gait and lameness if needed. Careful documentation and discussing findings with the owner ensure accurate diagnosis and appropriate treatment recommendations. 4. How do you approach diagnosing lameness in horses? Diagnosing lameness requires a thorough history, physical examination, and gait evaluation on different surfaces. I observe the horse walking and trotting, perform hoof testing, palpate limbs, and use flexion tests when appropriate. Diagnostic imaging, such as radiographs or ultrasound, may be necessary to identify underlying injuries. I explain findings clearly to owners and recommend treatment plans that prioritize recovery, pain management, rehabilitation, and prevention of future injuries. 5. How do you handle emergency equine cases? Emergency situations require calmness, rapid assessment, and decisive action. I prioritize stabilizing the horse by evaluating airway, breathing, circulation, and pain levels. After obtaining a brief medical history, I initiate emergency treatment while communicating clearly with the owner. I continually monitor the horse's response and adjust treatment accordingly. Remaining organized under pressure ensures the best possible outcome while maintaining client confidence throughout the emergency process. 6. What experience do you have with equine surgery? I have assisted with and performed various surgical procedures, depending on my level of experience and practice setting. These include wound repair, castration, laceration management, and emergency procedures. I follow strict aseptic techniques, monitor anesthesia carefully, and ensure comprehensive postoperative care. I also educate owners about recovery expectations, medication schedules, and follow-up appointments to maximize healing and reduce the risk of complications after surgery. 7. How do you communicate difficult diagnoses to horse owners? I communicate with honesty, empathy, and professionalism. I explain the diagnosis using language the owner can understand while avoiding unnecessary medical jargon. I discuss available treatment options, expected outcomes, associated costs, and possible risks. I encourage questions and ensure owners feel involved in decision-making. Compassionate communication helps build trust and supports owners during emotionally challenging situations involving their horse's health. 8. How do you stay current with advances in equine medicine? Veterinary medicine continues to evolve, so I prioritize lifelong learning. I regularly attend continuing education seminars, veterinary conferences, and workshops. I also read peer-reviewed journals, participate in professional organizations, and collaborate with experienced colleagues. Staying informed about new diagnostic methods, treatments, medications, and research enables me to provide evidence-based care and improve clinical outcomes for my equine patients. 9. How do you manage preventative healthcare programs for horses? Preventative care begins with individualized health plans based on age, workload, environment, and medical history. I recommend routine vaccinations, parasite control, dental examinations, nutritional guidance, and regular wellness evaluations. I also educate owners about biosecurity, exercise, hoof care, and early disease recognition. Preventative medicine reduces illness, improves performance, and supports the long-term health and well-being of horses throughout their lives. 10. Describe your experience with equine dentistry. Routine dental care is essential for maintaining horse health and performance. I perform oral examinations, identify abnormalities such as sharp enamel points or uneven wear, and recommend appropriate dental floating when necessary. I educate owners about signs of dental problems, including weight loss, difficulty chewing, and behavioral changes. Regular dental evaluations improve comfort, digestion, and overall quality of life for equine patients. 11. How do you prioritize multiple urgent cases during a busy day? I assess each case based on medical urgency, patient stability, and potential risk if treatment is delayed. Life-threatening emergencies receive immediate attention, while stable patients are scheduled appropriately. Effective communication with clients and teamwork with veterinary staff help maintain efficiency. Careful organization, documentation, and time management ensure every patient receives appropriate attention without compromising the quality of care or professional standards. 12. What steps do you take to ensure animal welfare? Animal welfare is central to every clinical decision I make. I use low-stress handling techniques, provide appropriate pain management, and recommend treatments based on current veterinary evidence. I educate owners about responsible care and advocate for humane practices. If welfare concerns arise, I address them professionally while following ethical guidelines and applicable legal requirements to protect the horse's health and well-being. 13. How do you deal with difficult or emotional clients? I remain calm, respectful, and empathetic while actively listening to their concerns. I acknowledge their emotions, provide clear explanations, and avoid becoming defensive. I focus on finding practical solutions that prioritize the horse's welfare while respecting the client's perspective. Strong communication skills help reduce misunderstandings and build trust, even during stressful or emotionally challenging veterinary situations. 14. What diagnostic tools do you commonly use? I routinely use physical examinations, blood tests, fecal analysis, radiography, ultrasonography, endoscopy, and lameness evaluations depending on the clinical presentation. Diagnostic choices are guided by the patient's symptoms, history, and owner expectations. Using appropriate tools efficiently allows accurate diagnoses while minimizing unnecessary procedures and ensuring cost-effective veterinary care tailored to each horse's individual needs. 15. How do you educate horse owners about preventative care? Education begins with understanding each owner's experience and management practices. I explain vaccination schedules, nutrition, parasite control, hoof care, dental maintenance, and disease prevention in clear language. I provide written recommendations and encourage regular wellness visits. Empowering owners with accurate information helps them recognize early warning signs and make informed decisions that improve their horse's long-term health. 16. Describe a challenging veterinary case you successfully managed. I treated a horse with severe colic requiring rapid assessment and coordinated care. After stabilization, diagnostic testing identified the underlying issue, allowing timely referral for surgical intervention. Throughout the process, I maintained communication with the owner and monitored the horse's recovery carefully. The successful outcome reinforced the importance of teamwork, quick decision-making, and effective client communication during complex equine emergencies. 17. How do you ensure accurate medical records? Accurate documentation is essential for continuity of care and legal compliance. I record examination findings, diagnostic results, treatments, medications, client discussions, and follow-up recommendations promptly after each visit. Clear, organized records improve communication among veterinary team members, support informed decision-making, and provide valuable reference information during future examinations or emergency situations involving the same patient. 18. What role does teamwork play in equine veterinary practice? Teamwork is vital. because quality patient care depends on effective collaboration among veterinarians, technicians, assistants, farriers, trainers, and horse owners. I communicate respectfully, share information promptly, and value everyone's expertise. Working together improves efficiency, enhances patient outcomes, and creates a supportive work environment where challenges can be addressed collectively for the benefit of every equine patient. 19. How do you manage biosecurity on farms? I follow strict hygiene protocols, disinfect equipment between patients, wear appropriate protective clothing, and minimize disease transmission through proper isolation procedures. I educate farm managers about quarantine practices, vaccination programs, sanitation, and visitor protocols. Strong biosecurity measures reduce infectious disease outbreaks, protect healthy horses, and safeguard the overall health of equine populations under veterinary care. 20. How do you handle euthanasia discussions with owners? Euthanasia conversations require empathy, honesty, and compassion. I explain the horse's medical condition, prognosis, and available treatment options before discussing humane euthanasia when appropriate. I allow owners time to ask questions and make informed decisions without pressure. Providing emotional support and ensuring the procedure is peaceful helps families navigate one of the most difficult aspects of horse ownership. 21. What qualities make an excellent equine veterinarian? An excellent equine veterinarian combines strong clinical knowledge with compassion, communication, critical thinking, and adaptability. Attention to detail, physical stamina, ethical decision-making, and a commitment to lifelong learning are equally important. Building positive relationships with clients while delivering evidence-based veterinary care ensures successful outcomes for both horses and the people responsible for their health and management. 22. How do you handle stressful situations in veterinary practice? I remain focused by assessing priorities, following established clinical procedures, and maintaining clear communication with my team. I avoid rushing decisions while responding efficiently to urgent situations. After challenging cases, I reflect on lessons learned and seek feedback when appropriate. Maintaining professionalism under pressure supports better patient care and promotes a positive working environment. 23. How would you handle a disagreement with a colleague about treatment? I would approach the discussion respectfully and focus on evidence-based medicine rather than personal opinions. I would review diagnostic findings, consult relevant veterinary guidelines, and consider the patient's best interests. Open communication and professional collaboration often lead to better decisions. If necessary, I would seek additional expert input while maintaining mutual respect and ensuring continuity of patient care. 24. Why should we hire you as our equine veterinarian? I bring strong clinical skills, dedication to animal welfare, excellent communication abilities, and a genuine passion for equine medicine. I work well under pressure, collaborate effectively with veterinary teams, and prioritize evidence-based patient care. I am committed to continuous professional development and providing exceptional service to both horses and their owners while contributing positively to your veterinary practice. 25. Where do you see yourself in 5 years? In 5 years, I hope to become a highly skilled equine veterinarian with advanced expertise in equine medicine and surgery. I plan to continue expanding my clinical knowledge through continuing education and professional certifications. I also aim to mentor junior veterinarians, strengthen client relationships, and contribute to a respected veterinary practice that values innovation, teamwork, and exceptional patient care. Success in an equine veterinarian interview depends on demonstrating clinical expertise, compassion, professionalism, and excellent communication skills. Employers seek candidates who can diagnose accurately, work effectively under pressure, collaborate with colleagues, and build lasting relationships with horse owners. By preparing thoughtful responses to these common interview questions, you can confidently showcase your veterinary knowledge, problem-solving abilities, and commitment to equine welfare. Consistent practice will help you present yourself as a capable, reliable, and dedicated equine veterinarian ready to excel in a professional practice.